Hello and welcome to a brand new German New Medicine tutorial. I'm your host, Dr. Melissa Sell, and you can learn more about me and my services at drmelissasell.com. Today we will be discussing the kidney collecting tubule conflicts and something that Dr. Hammer calls the syndrome. And these particular conflicts and the syndrome are some of the most important discoveries that Dr. Hammer made in his research regarding biological special programs. So I'm very excited to be sharing this tutorial with you today. For those of you who are new to German New Medicine, please check out GNM 101 before watching this video so that you have the entire context and background for understanding GNM before we get into a particular conflict. The information contained in this presentation is intended for educational purposes only. It is not a substitute for professional medical advice. Here is a list of the resources that I used in the creation of this presentation that you can check out on your own. And let's get started. So GNM, what's the basic premise? All tissue changes, Dr. Hammer discovered, every time we have symptoms, every time there's something going on other than normal with our body, except for the cases of an injury, a poisoning, or a nutritional deficiency, they're due to very specific, very intentional biological adaptations that are controlled and coordinated from the brain. So these adaptations are initiated by something shocking that catches you off guard, something traumatic that causes your body to shift from a state of all is well, normal, everyday activities to we're in trouble, fight or flight, sympathetic mode. And so every health problem that we deal with is due to one of these type of conflict shocks. And so when you understand, we can work backwards by looking at what symptoms you present with. So what's going on with you? Are you having pain in an area? Are you retaining water? Those symptoms tell us a story of what conflict you experienced or what you are currently experiencing. Symptoms typically show up during the healing phase, and the kidney collecting tubule conflicts is actually opposite to this. These symptoms of water retention show up while you are actively having and experiencing the conflict. So we have to identify and become aware of the conflict source so that we can resolve it and prevent it, hopefully, in the future from happening again. Dr. Hammer discovered 5 biological natural laws, and the first biological law involves the psyche, brain, and organ connection. So what he found was that the moment that a person suffers a conflict, at that moment, your nervous system perceives that there is something going on. It's immediately interpreted by your ancient brain, and your body determines what is the best course of action, what tissue needs to be adapted for maximum survival. So with the fish out of water conflicts or the water retention conflicts, the brainstem is affected. And I'll show you the area of the brainstem in particular. And what happens is in that moment that the conflict occurs, simultaneously the psyche, the brain, the organ, all is affected. And the biological program, the button is pressed and the whole thing is set into motion. And so for this type of conflict, there is a proliferation, so additional tissue cells within the kidney collecting tubules. And for every special biological program, there is a biological meaning. There is an understandable reason that your body is doing what it's doing. Now, we have to remember that these biological programs, they evolved in a very different environment than the one we currently live in. And GNM is also based in the science of evolution and embryology. So evolutionarily, organisms all started out in the water, in the ocean. And so we were water-dwelling creatures. And what is the most life-threatening situation for a water-dwelling creature? Well, that's being washed up on the shore, being away from your home, being away from your environment, your source of love and nutrition. And so being out of the water is pretty much the worst thing that could possibly happen. And even now, as human beings, our body is mostly water. And so it's very important that we have ample water to run all the functions of our body. So what happens in this particular type of biological program is the kidney collecting tubules essentially are being dammed off. They're blocking off the release of water from the kidney so the water is retained for survival. And so that's where it's so important to understand that this is an adaptive response. Your body is doing it in response to something going on in your environment that's being perceived. So the kidney collecting tubules, what are they? What do they do? What they do is they collect the urine that's produced by the kidney parenchyma. So the kidney parenchyma has a different biological program associated with it, and so it's a little different than the kidney collecting tubules. These tubules are formed from the most ancient biological tissue type. Remember, embryologically, we look at the germ layers. The germ layers are the original tissues from which all of your body tissues are made from. And so this is endodermal origin. So it's the oldest tissue within the kidney. So you can see this is the collecting tubule that takes the urine and passes it down to the other areas of the ureter and the bladder and the urethra so it can get out of the system. So we're blocking it off at the collecting tubule point so the water can't exit the body. So this is the brain area, the brain region. So every organ in your body is tied to a very specific brain area. And so the endodermal derived tissues all have their control center in the brainstem, because the brainstem is the oldest, the most ancient part of our brains. And so if you did a CT scan, and in the future, this is going to be the gold standard of medicine, is that every person having an issue will come in and have a CT scan, and someone will read that CT scan and look for the Hammer focus, look for the brain impact, where you see that pink pulsating circle. That's where you will find the Hammer focus if someone has a kidney collecting tubule conflict. And the ring will be a sharp ring if it's conflict active. It'll be a fuzzy ring if it is in the healing phase. And so those are the kidney collecting tubule relays. So what are the conflicts that cause a person to retain water? So remember, fish out of water. When we are feeling like we are not surrounded and safe. So an abandonment conflict can trigger a kidney collecting tubule conflict, which causes the body to shut off the tubules to retain water. So if a person is feeling unloved, excluded, left out, if they feel rejected, forgotten, isolated, and you can just look at the life experience of a human being. What types of situations can we feel like we are not included, that we've been left out in some way? A big one in childhood is being sent to a babysitter or to a daycare. And so remember, children, they just have these most primal responses to their environment. They don't intellectually understand that mom and dad have to go to work and they'll be back every evening to pick them up, but they go so they can, provide for the family. They don't understand those dynamics. All a child understands is I'm no longer with the people who smell like me, who I know are, the people that I'm supposed to be with. And all of a sudden I'm in this new environment with all these other people who, there's this innate sense that I may not be safe. And so if an individual child, because again, this all depends on individual perception. Not every child has an abandonment conflict when they're, sent to daycare, but some certainly do. And there's actually a study that was done in 2012 that found that children who do attend daycare were 65% more likely to be overweight between the ages of 4 and 10 compared to those who stayed at home with a parent. With the water retention, we carry that water, it's stored in our fat cells. And so it may cause a child or a person to appear to be overweight, and it's, they could have a great diet and, exercise, get plenty of movement, but still be gaining weight if they are active with this particular conflict. Now, another situation is a new sibling at home. So again, a little child who doesn't really understand, new baby in the house may feel alone or abandoned by their parents. Elderly people being put into a nursing home. There's a very interesting thing Dr. Hammer found is that a double conflict in the brainstem, let's say affecting both the right and the left side of the kidney collecting tubule, Remember, in that brain segment, you can have it on the right or the left or both. If a person has both of them, that's called a conflict constellation. And Dr. Hammer found that that's actually the manifestation of Alzheimer's symptoms, is if a person has double brainstem conflicts. And so that's a whole nother topic, but very interesting to note. A person who, is no longer, maybe they lost their, their spouse, their significant other, their children may live out of state, and they're, sent to live in a new environment, a new home that is, maybe where they don't want to be. Divorce, again, a parent leaving, a child not understanding, and possibly feeling abandoned. All of these situations are one where you can understand that a human might feel like they are left out, rejected, fish out of water, no longer, with their pack, with their, people, their home. Again, with the home, refugee conflict. If you have been kicked out of your country, even if you've been kicked out of your house, if you are homeless, if you're just kind of uprooted for a while, even far from home, people who take long trips, travel overseas, may have this sense of I'm not at home, and may even suffer from some water retention while they are traveling abroad. I believe that the common phenomenon known as the freshman 15, which is where 18-year-olds head off to college for the first time, leave their home, and the idea is that they are up late, partying, eating tons of pizza and ramen noodles, and that's the reason that they gain weight is due to nutrition changes. But I believe it has more to do with being far from home, being away from their nest, their environment where they grew up for 18 years, and that triggers a refugee conflict within them, causing the retention of water. If you have no place to call home, if you're on the run from some kind of situation, this can trigger, again, fish out of water, away from your home, away from your place of security, can trigger a kidney collecting tubule conflict. Existence. Now, this is where we get into some very, very important, very profound things to understand about this biological program. When you have a fear of death, because ultimately that's what it is. If you are washed up on shore, if you're away from your pack, if you're, on dry land, away from everything, you're afraid to die, essentially. You don't want to dry out. You don't want to starve. You don't want to, get attacked by a predator because you're away from your protection. So ultimately, this fear of death can also trigger the kidney collecting tubules to close off and retain water. And so this can happen in all sorts of different situations. A diagnosis shock, if you are hospitalized. So not only are you scared for your life because you're in the hospital or had to ride in an ambulance or something happened to you, you're, scared to die, and you're away from your family in an unfriendly, hostile, sanitary environment with all sorts of strange faces and bright lights. There's some kind of fear that I might die. And if you fear you might die, your body will retain water. And so feelings of complete devastation and loss can trigger this. So let's say you lost a large sum of money. If you had a major financial crisis, financial issues can trigger an existence conflict. I know in my past that I've had, money worries. My parents had money worries. And I know that for me, if I ever am freaking out about money, that will cause me to, I just feel kind of bloated. I feel that there's excess water around my midsection, and I know that for me, it's an existence conflict that has been activated, causing me to hold on to water. And so, there are things that I do mentally to shift my focus, to allow myself to relax and relieve myself so that my body can let go of this water I'm holding on to. Once again, it's all depends on the individual and their situation and their circumstance and what are they experiencing? How are they seeing this situation that's causing them to have this type of conflict? Another conflict, and this one makes, again, perfect sense, if you've got too little water, if you're afraid of drying out or dehydrating, too little protein. Let's say you're even on a hike. A couple weeks ago, I went on a hike and I didn't want to carry my water bottle with me, and it was hotter than I expected. I sweated a little more than I expected, and I got to the top and I was like, well, geez, I really wish I had some water. And in that moment, I can see that my body could have a dehydration conflict. And what makes the most sense? What does my body have access to? Well, let's hold on to the water that's already in our system. Let's not let it out so that we can make sure we've got enough water until we secure a new water source. Now let's go through what is happening on the organ level. What is going on when this conflict is active? Remember, with the second biological law, the law of two phases, we're dealing with the two halves, two branches of the nervous system. The sympathetic, which is the fight or flight, that's the daytime mode, and then the rest and digest, that's the rest, repair, reproduction mode. And normally we cycle from daytime being more sympathetic to evening time being more vagotonic, and we normally go through that day-night rhythm. Now, the moment of the DHS, the moment you're like, oh my gosh, my life is in danger. Oh my gosh, I'm feeling alone and kicked out. Oh my gosh, I don't have any water and I'm scared I might be really, die of thirst. So at that moment, that's when you shift into conflict activity. And so let's look what that looks like for the kidney collecting tubules. So now we're in sympathicotonia phase. So there's cellular proliferation in the kidney collecting tubule. That's, like I said, it's kind of damming off, shutting off the exits for the fluid. And so now your body starts to retain water. So you might sense that as bloating. You might sense that as weight gain. 1 liter of water, so let's say you're drinking your water like you think you're supposed to. A lot of people, we drink a lot of fluids in our society. We just do. We drink for fun. We don't even always drink just when we're thirsty. We drink recreationally. We have a kombucha. We have a tea. We have a coffee. We go out to, drinks with people. So we're taking in a lot of fluids. And if those fluids are not being exiting the body, you can hold that and it inflates your fat cells. And you can hold up to 2 pounds of water for 1 liter of water taken in, held on as water weight. So you're not going to be urinating as often. That's something that you can notice to know if you're in conflict active phase. Your urine's going to be darker. You may have dry, hard stools or difficulty going to the bathroom. Increased uric acid, urea, and creatinine. And the purpose of this is, again, your body kind of couples being out of the water, being away from your home, being away from your resources, also with a potential for starvation due to protein deprivation. And so what happens is your body holds on to these particles, this uric acid, urea, and creatinine, because it can recycle it and use it to protect against starvation. So that's a very interesting thing to know if you are having a diagnosis and they're saying, oh, you've got increased of these substances in your system. Again, there's a very specific reason this is happening. Another potential is a renal cell carcinoma. And so if the conflict just continues and continues and continues, the collecting tubule can continue to proliferate to the point of a tumor. And so you can see in that image on the right that this area has been the body has really proliferated additional, more than enough. That means that the conflict has gone on for a very long time. And remember, biological origin, when this all started, when these biological programs first evolved, you wouldn't be conflict active with, one of these fish out of water things for years. You really would either you'd die because you didn't have access to, or you'd get washed back in the water, or you'd, maintain or regain your safe environment. It wouldn't happen for years and years on end. But humans, our capacity, our brain power, we can stay active with these types of conflicts for a very, very long time. And so they can progress to a point where you have a mass of cells that is working to close off this area. So once again, looking at the psyche-brain organ connections, in the psyche, you're compulsive thinking. You're thinking about this problem, this existence, this abandonment, this refugee, this finding a new home. You're preoccupied with it. Some potential behavioral manifestations, which are very interesting, which also makes sense, is the tendency to hoard or stockpile, a person being clingy or very possessive, because of this underlying feeling of needing a safe environment, needing people around you, needing to stockpile or hoard resources because you have this deep underlying fear. Once again, in the brain, we see that sharp, ring Hammer focus in the brainstem, and the organ-level proliferation of the KCT tubules. Conflict resolution. So this is the goal. We want to recognize if we've got a conflict active and do whatever it takes to resolve that conflict. Now, this is most important if, in the case of the syndrome, which we'll talk about in a little bit, when you have another conflict that's in healing and the water retention is worsening the symptoms of the healing phase, conflict resolution of the water retention conflicts becomes of utmost importance. So obviously, a natural resolution, as always, with all the biological programs, a natural resolution is the best. So this is if you are, needing to move at the end of the month and you haven't found a new house yet and it's causing you to, have this kind of I'm going to be kicked out sort of feeling, finding a new house, securing a nice place to stay. If you are in the hospital and being in the hospital has been freaking you out because you're away from your family and your environment, you're feeling kicked out, you're really scared to die, all the beeping machines, and you get out of the hospital and you're finally in a nice place back at home or somewhere where you're more comfortable. If you were worried about finances, getting some income, securing a new job or some kind of income source so that you don't have to worry about access to resources. And so if a natural resolution is not possible, that's when you shift into perspective changes, changing your mindset, emotional release or forgiveness, understanding others. So if this was something that you feel like you're kind of holding on to an abandonment conflict because 25 years ago your dad left or something like that, understanding and shifting your perspective and forgiving and changing your priorities, seeing things in a new way, that may be the resolution that you need because, you can't go back and change what happened back then. If you would like help with this particular step in the process, the conflict resolution, that's what the Resolve community is all about. It's a conflict resolution resource center. For the month of September in the Resolve community, each month we do a brand new module covering a particular conflict type and talk about the nature of these types of conflicts, perspective shifts that you can make to allow yourself to resolve these conflicts. And for September, we covered abandonment, isolation, and refugee. October of 2018 will be covering the existence conflicts, the fear of death, the fear of not having enough financial resources. And so that's going to be in October. But if you want help with this, that's what that community is all about. So once you've resolved it, the body shifts gears. It moves from sympathetic dominance to parasympathetic dominance. And so this is rest and digest. You are relieved, you are feeling secure, you're feeling safe. And so the body now that it has that message, it knows that we don't need to block off these kidney collecting tubules any longer. We need to release the fluid. So fluid will be released through all of the open kidney tubules that are available. And so you will notice that you are running to the bathroom. Your body is releasing this water that you've been holding on to. And then also the body starts going to work, breaking down the dams, breaking down the excess cells that were proliferated using fungi and mycobacteria. And so during this time, you may get diagnosed with some type of kidney infection, renal candidiasis, bacterial infection, kidney TB. You may have cloudiness in your urine because of the debris, the cellular remnants of this breakdown process. And again, this is all a normal part of the biological program. So frequent urination, you're up at night to urinate. You may have some pain. Heavy nighttime sweating is also part of it. Protein in your urine, lower protein in your blood. So during the breakdown of these types of additional cell growth, and so these are all the ones that are controlled from the brainstem, the tubercular bacteria in this breakdown process, it takes a lot of protein. And so it's very important that during the healing phases of these conflicts, you are consuming adequate protein. You may also have blood in your urine during this time, again, just as part of the breakdown process. The psyche is relieved, you've resolved the problem in the brain. Now you go from a sharp ring configuration during the conflict to a diffused ring because there's fluid in the brain during the healing process. This may cause some dizziness or dull headaches. And again, we mentioned at the organ level, the tissue breakdown of the additional cells. During this time, it is important to be, drinking adequate fluid in order to flush out the cellular remnants. The epileptoid crisis is the halfway point of the healing phase, and this is where there's a surge of sympathetic dominance. You may have, some severe kidney pains, some chills, cold sweats, shivers, and this is when the major squeeze is happening so that we can push out the rest of the edema. We push out the edema from the brain, and we kind of turn the corner so we can get to PCLB. And so that's post-conflictal lysis phase B, and this is the parasympathetic scarification, continued remodeling and restoration. We are returning back to normal. Let's talk about the syndrome. So this is the most important SBS by far, and it occurs when you have an active KCT conflict. So that's all the stuff we've been just talking about. While you have another significant biological special program that's already in the healing phase. And so there are many examples of this. Here's one. So let's say you were feeling unsupported and you had a severe self-devaluation conflict, which was affecting the bones, possibly the discs, the soft tissues of your lower back. And if that conflict, when that goes into the healing phase, you resolve the self-devaluation, you're in the healing phase, there's going to be pain anyways. There's going to be, discomfort and swelling and tension in the low back. Now, if you also have a kidney collecting tubule conflict that's active, that's what's called the syndrome. And this intensifies the pain. You could have some severe sciatic pain, let's say if it's involving the disc and your lumbar disc is swollen because you're retaining all of this water. The water is going to go to the area where the water is. So it's going to go to the fat cells, but it's also going to go to any area that happens to be in healing. And so you could have severe sciatic pain, possibly even a disc rupture because it's inflated. There's more water than there should be inside of that tissue. It's an interesting mix of symptoms because you're both in the sympathetic activity of the KCT conflict, but then you're in the parasympathetic activity of the other conflict that you've got going on. So you're kind of like strung out stress fatigue. So you're stressed out, but you're also exhausted because your body is healing a different conflict. Here are some of the complications that can occur when you've got the syndrome active. Tumors can appear to swell or appear to grow. So let's say you've got an intraductal breast cancer tumor, and that tumor, it's a healing scab, and during the healing phase, there's going to be natural swelling. But let's say you've got a kidney collecting tubule conflict on top of it. Now you're retaining water, and it's almost like that tumor is inflating, and it may look like it's growing. Increased pain because it stretches the tissue. Inflammation. Pretty much all of your symptoms are going to be more intense. You may have enlarged organs, such as your liver. If you have a cyst, again, the cyst kind of inflates and might even burst. Ascites. Ascites is a sure sign that a person is in a state of fear. Fluid in the lungs, pleuritis. So you've got this swelling pressure on your lungs because you've got a conflict that's in healing, and then you also have all of this water retention. Severe brain edema. And so there's brain activity, there's brain swelling. If there's a lot of fluid that's being retained, this could even induce a coma. There could be pressure on the brainstem, which is a respiratory danger. And so I'm sure that you're understanding at this point that it's just so important that you understand that if you have this panic, if you have this fear, if you are, scared for your life on top of some other diagnosis and you're in the hospital and it seems like things are just getting worse and the pain is getting worse, you have to look into if you're retaining water, if this syndrome is active. Because the first thing to do is to identify it and to work to resolve the abandonment, isolation, existence, refugee conflict first. Because what that's going to allow you to do is release the water so that we can bring down the intensity of the swelling, and then we can focus on understanding whatever other conflict happens to be in the healing phase. Because that fear that occurs during this time, it tends to escalate and make a problem seems so much worse than it actually is, when it's really just all of this water retention that's causing everything else to go haywire. Now, another thing to caution is the medications and drugs that, especially if you're in a hospital setting, that we tend to get prescribed, like corticosteroids or chemo or morphine. All of these intensify the sympathetic phase of the body, which is not going to help us if we are trying to resolve a conflict and we're trying to get into the healing phase. And so those are things that should be used with caution or not at all, especially if a person is retaining water. And so that's why we really look forward to the day when medicine understands the biological laws, when they understand and they see a person who's in this extreme intense state, and instead of scaring them more, they do whatever possible to help that person feel safe, help them feel comfortable, help them feel at home, like everything's going to be okay. And so that's really the goal here, is to get to that state of, okay, I'm safe, so my body can release this water and we can set to work on understanding and deepening our understanding of what's going on with these other conflicts. So if a kidney collecting tubule conflict has been prolonged, if it's gone on for a long time, or if it's been, you kind of go in and out of it, you've been in a hanging healing, you may develop one of these conditions regarding your kidneys. So kidney stones, calcium oxalate kidney stones, nephrotic syndrome, diabetes insipidus, cirrhosis of the kidney, or cystic kidney. Because once again, these types of conflicts in nature never really would, happen again and again and again. They typically would happen maybe one time, the biological program would run its course, and, you would be fine. But because of the way that humans deal with conflicts and how we can have ongoing conflicts for years, we can have ongoing complications. So there's the fluid balance test. So if you're curious, you're like, I don't know, maybe I'm retaining water. I can't really tell. Maybe I've been, this is just my normal. Test it. Find out. It may be abundantly obvious to you, the amount of water that you're drinking versus the amount that you are expelling. It may be very obvious that once you become aware of this conflict, you say, oh my goodness, I must be retaining water. You look at your weight and your weight going up and your water amount going up. If it's kind of borderline and you're not really sure, you can do the fluid balance test and measure your fluid intake and your urine output. And if the amount taken in is significantly more than is leaving, that indicates that you've got an active conflict. If you're urinating way more than you're taking in, that means you're either in the healing phase of a KCT conflict or possibly another conflict that's in the urinary phase. So here are a few helpful remedies if you're dealing with water retention. Obviously, this is in addition to discovering a natural resolution or some type of emotional resolution. An Epsom salt bath, kind of get your body back into its natural home. Swimming in the ocean can also have this wonderful effect. Sweating, infrared sauna, enhancing feelings of coziness, of at-homeness. If you happen to be away from your home or you have to move, what can you do to make that place feel more cozy, feel more like home? How can you enhance those feelings that you are safe? What smells do you like? What can you do to change that environment? Deep breathing is extremely helpful, lymph drainage massage, minimizing your fluid intake, not to a feeling of deprivation where you feel like you're, dehydrated or very, very thirsty, but just monitoring it. Like I mentioned earlier, we drink so much fluid just recreationally. We don't even listen for the most part to the cues of when we're actually thirsty because, we're drinking coffee, we're drinking tea, we're drinking all sorts of things. And it has nothing to do with quenching a thirst. It's more, for fun or for recreation. So pay attention to your fluid intake. Now let's review the third biological law. Remember, we in this conflict are dealing with a brainstem controlled conflict, endodermal tissue, that's the old brain. So during conflict activity, there's cellular proliferation, and then once the conflict is resolved, there's cell removal with fungi and bacteria during the healing phase. Fourth biological law, we need that bacteria. We need this tubercular bacteria and fungus because they optimize the healing phase. If for some reason the bacteria are not present, when your body needs to break down the extra cells that were proliferated, they just stay there. They're encapsulated. If enough of them, you may have a silent kidney, which is where the kidneys just doesn't seem to be filtering at all, and that indicates that you've had probably multiple kidney collecting tubule conflicts affecting the kidneys, and it's kind of closed off all of the openings. And you didn't have the adequate bacteria to break it down to open that area or open up those channels again. And so that's just such an important thing to keep in mind. We need this bacteria, we need this fungus in our system because they co-evolved with us. They are seasonal workers. They are on the scene doing what they need to do to help us restore normal balance to the body. And the fifth biological law, this is the quintessence. This is remembering that disease is not an error. The symptoms of your body are all purposeful. They're all geared towards survival and reproduction. Your body is not making a mistake. So we want to survive. We're programmed for maximal survival. And so these programs evolved over millions of years. A lot of them don't make sense anymore. A lot of them just, with our modern society, they don't help us practically. But we have to remember our biological origins. Our bodies are much, much older than our new brains are. They're programmed with different information. They developed in a completely different environment. And so we have to honor that. We have to remember that. We have to remember that we're these big brains that are carrying around ancient software. And so when you keep that in mind and you understand that there's so much more than just your psychological experience, you've got this biological history, you can see and get into rapport with what your body is doing. And once you understand it and you know how to navigate it and you know how to change and alter your perception to send the proper signals to your body, then we're working in harmony. Okay, so moving forward, if you want more of my methods for resolving active conflicts, join Resolve. So the Resolve community, it is a monthly membership site. You pay every single month to be in the community, and you have access to all of our training videos. We've got Conflict 101, Conflict 201. We have a module on self-devaluation specifics regarding the head and neck. So if you've got head pain, neck pain, issues with degeneration, spinal issues, you definitely want to check out that module. And our most recent module that we released for September of 2018 is the water retention conflicts. We got started with refugee, isolation, and abandonment. Coming in October, we will be covering the existence conflicts. And so if you've got water retention, if you know that you kind of regularly deal with feelings of abandonment or feeling left out, you are going to want to get into Resolve and check out this month's module. Every month we have training videos, note pack, a journaling workbook, which is phenomenal for you to dig into the elements of what this conflict is made out of for you in particular, and guided meditations to help you to shift from that state of conflict activity, of things are not okay, of I'm not safe, I'm not included, to all is well. And the Resolve programs show you exactly how to do that. If you are a practitioner, if you are a health coach, if you are an aspiring health coach, if you want to use German New Medicine in your work with patients or clients, join the Inner Circle. That's where my partner Steven and I, we teach you how to teach this to other people, how to show them these perspective shifts, how to understand how they are currently creating their experience, what their perception is made out of, and how to teach them this way of thinking using German New Medicine. Absolutely phenomenal program. So thank you for watching. Share this video with someone who needs to see it. If you would like to join one of the programs, you can get $5 off the lifetime of your membership if you use the coupon code YouTube. You can check out the Resolve community at bit.ly/the Resolve method, all lowercase. You can always email me, drmelissacell@gmail.com. Check out my website. I do consultations, life history investigations, where we do a deep dive into your personal history, what you've dealt with, what you've got going on, so we can make the connections between your symptoms, what your body is telling you, and your life experiences, and discuss the different things that you can do with your perception, with your mindset, to make the changes so that your body can get the message all is well, and so that you can heal. Thanks again for watching. Please subscribe to my channel. Feel free to join my free Facebook group. That's the German New Medicine Self-Healing Support Group, where you can ask questions, send me a message, let me know how I can help you.